Hi, I'm Mike Tierney of Data Not Distress, and in this video I'd like to answer the question, who is truly at risk for airborne disease like COVID-19? There's a subset of our population who is vulnerable to airborne disease, and based on United States CDC data, as well as data from around the world, there is no difference between the threat of COVID-19 and any other year's cold season. If there's one good thing that came out of this year's cold response, it is more awareness of those vulnerable to airborne disease and the everyday threat that they have always faced, every moment of their lives. It should always have been socially acceptable for the vulnerable to wear masks in public. In Asia, they also wear them to reduce seasonal allergies. And just like any other item of clothing, a personal choice. However, no matter what, anything more than drawing open air from around you into your lungs is a strain on the respiratory system and a risk in and of itself. So masks should only be worn as a mitigation by the vulnerable, be it to allergies or airborne disease. But it is more difficult to know who is vulnerable when the CDC and others do not seem to draw any attention to their own data to publicize who is actually vulnerable to COVID-19. So let's take a look at the actual data. First is a comparison of the demographics of COVID-19 deaths versus our usual 57,000 annual pneumonia and influenza deaths. In all cases, 93% of deaths are of those ages 55 and older. COVID-19 can be a bad cold, and so the ages skew a bit lower in the elderly demographics. But the big takeaway is this. Every single year, the risk profile is the same. And so every year, those age 55 and older are largely at the same risk. To be sure, there are those under age 55 who die from cold and flu in the US every year, almost 11 per day. And if we had always been looking for stories to fill newspapers with about them, we could have had entire publications dedicated to them year-round every year. But the usual incidence rate of those under age 55 is 1 in 100,000 persons in the United States, or so far with COVID-19, perhaps 2 in 100,000. By comparison, there are 12 gun deaths per 100,000 in the US every year. We regularly face much bigger threats. Demographics from around the world show a refinement on risk profiles, particularly the effects of the exposure to greater levels of pollution. The US has an average national PM 2.5 pollution level of 9 micrograms per cubic meter, with 11 to 12 considered the good range, where most people live in cities. Switzerland has a similar national average, around 10, which, with less land area, seems to be the level experienced in their cities, which would be lower than the United States. This likely accounts for some of the differences in their COVID-19 demographics. In Switzerland, 99.8% of COVID-19 deaths were age 50 plus, with 70% being 80 and over. One way or another, they have an incredibly healthy population. But better air could account for much of that, considering Thailand's COVID-19 demographics. Thailand has an average national PM 2.5 level of 23, almost 3 times the average United States level. The result is a much lower set of age groups dying from COVID-19, with some 28% below age 50. So, it would be fair to say that only those elderly by age, or those whose bodies are elderly due to disease, including respiratory illness, brought on by environmental problems, are vulnerable to dying from airborne disease like COVID-19. Hospitalization is a more uncertain area, since it can be a factor of level of concern plus economics. If someone is willing to pay $2,000 per day for a hospital bed, there's probably someone who will take them up on it and admit them no matter what. But the United States Hospitalization Statistics for COVID-19 are enlightening. First off, 74% of those hospitalized were age 50 plus. There's a good-sized younger population of 26% included in that, but when you then look at the hospital admissions by pre-existing condition, you see a much clearer picture. only 4% of admissions had no known pre-existing conditions. In a country with at least 8% of the population uninsured and likely unable to afford to see a doctor to have a pre-existing condition diagnosed in the first place. So, put quite simply, to be at risk for being hospitalized with COVID-19, you first need to be dying of something else. In summary, there are two main groups who are at risk of either dying or being hospitalized with COVID-19 in the United States. Those over 55 or those with underlying life-threatening health conditions. For anyone else, you are 6 times more likely to die of gun violence in the United States than be adversely affected by COVID-19. Virus avoidance behavior causes more extreme airborne illness, which results in more deaths of the vulnerable. So to actually save lives in a pandemic, it is essential to allow those who are not vulnerable to live normal lives and leverage our only defense against deadly airborne disease, which we've used with a 100% success over the last 300 million years as animals.